Chapter 21 was on forensic mental health practice within the community. So we will be outlining the history, barrier to entry, and value of OT in this population and setting. Starting off with history, as we remember from psych last year, deinstitutionalization came in the 1950s and state hospitals began to close their doors for mental health patients in order to help them within the community. Even though this saved a lot of money, it was ineffective because we began to see an increase in mental health patients in jails and prisons because their needs were not being met in the community. In this diagram, we can see how the decrease in mental hospitals and increase in patients in prisons correlate with each other. So, who is this population? I am sure most of us have heard the phrase plead insanity, which means that they are identifying themselves as needing mental health services, and then their case is transferred to a specialty court. They can be individuals of any age, gender, and ethnicity. There's no certain crime or diagnosis that puts you in this category, so the clients that an OT works with could have significant differences. As you can imagine, there are barriers for OT in this field due to two major reasons. The first is reimbursement because there's not enough value placed on OT as a mental health professional, and money can go to other positions that have high turnover rates. The second reason is because of the possible danger that it puts people in. Occupation-based activities would have to be very thought out and could take a wrong turn very quickly. Going back to the philosophers that created the occupational-based theories that we know, humans are occupational beings and this population needs OT. In the long run, it will save money by decreasing the number of hospital beds or prison beds these clients are taking. It will decrease repeat offenses by offering the appropriate community supports, and it will increase public safety and awareness. The goal of community-based practice is for the integration of the principles of law and care for the individual that they could be used as a social force to enhance quality of life. The areas of occupation that would impact a client's quality of life in these circumstances would be very diverse in nature. But when you think about the life that they have lived in prison or mental hospitals, it makes sense that they would need help setting up a schedule, cooking, cleaning, planning their finances, understanding the legal concerns, and creating healthy habits. Another area is problem-solving skills and helping the individual to make thought-out choices in the future. So in conclusion, judging a person doesn't define who they are, it defines who you are. Everyone deserves to be heard, everyone deserves the highest quality of life possible, and OT needs to help see that vision through.